Aloha! This CME activity is jointly provided by the Queens Medical Center and UH-JABSOM Department of Geriatric Medicine. We offer free continuing education for this series. In order to receive a CME, participants must complete the online evaluation at the end of the webinar. Your comments are very important to the planning committee and will be used to plan future programs. About ECHO, we want to remind everyone that this is an ECHO webinar, which means that this session serves as a forum for mutual teaching and learning from experts and from each of us on the front lines. As the ECHO motto goes, all teach, all learn. So it will take all of you to create this community of learning. In the spirit of aloha, we encourage you to turn on your cameras to help us build a community of learning. Feel free to eat during this ECHO session. Good nutrition is key to a healthy lifestyle. A little bit about our format. After a short lecture from our experts, we will share expertise from the rest of the team and then open the time up for case discussions. We invite you to share any geriatric cases. It may even be on a topic not related to the topic of today's lecture. We only ask that you keep it HIPAA compliant, case for discussion. That means please do not share patients' name, birthday, addresses, and so on. We learn best from our patients. They are the best teachers. Our interdisciplinary team is here as well, and we are all willing to teach and share our collective wisdom with you. Most of you already know me. I am Gwinnett Gaylord, President of Alliance of Residential Care Administrators, ARCA. We have Maribel Tan, President of Foster Family Homes Association, Elsa Talavera, President and CEO of All Island Case Management Corporation, Brittany Pacheco, Health Coordination Manager for Big Island and Kauai, and LTSS Coordinator from Aloha Care, Leila Ventura, Health Coordination Manager from United Healthcare, Kauai County, and Dr. Ritabel Fernandez from University of Hawaii. We just finished a 4-month series on mobility. If you're interested in viewing any of those lectures and handouts, you can find them on our website. Unfortunately, we cannot offer certificates of attendance for videos you have reviewed. You must participate in our education live to receive them. We are now in the second month of our 4-month series on mentation. The title of today's webinar is Safe Return for Wanderers. It gives me great pleasure to introduce our speaker. Dr. Poki'i Balaz is a public health executive leader who has dedicated her career to advancing health initiatives through innovative strategies in healthcare policies and systems change, with an emphasis on aging and advocacy for underserved and aging populations. Using both her clinical and leadership abilities, she has addressed critical healthcare issues and advocates for the improvement of public health and the welfare of marginalized communities. As a Native Hawaiian, geriatric nurse practitioner, caregiver to her father who has Alzheimer's disease, and her nephew who is autistic, Dr. Balaz has seen firsthand how a cultural approach to caregiving improves health outcomes for aging individuals, as well as how cultural values motivate the surrounding community to participate in a continuum of care. Accepting invitations by both her congressman and governor to contribute to the Native Hawaiian Advisory Council and Policy Advisory Board for Elderly Affairs, Dr. Balaz has advocated at the nation's capital and worked on legislation that protects the interests of aging residents and that educates families on the complexities of healthcare for aging relatives. Aloha, Dr. Balaz, and welcome today.
Thanks, Haina. Thanks for that introduction. I appreciate it. And it's really nice to see some familiar faces in the boxes around. And before we get started, please, everybody, if you want to share anything, like they were mentioning earlier, please just open your mic and jump in or add to the chat. I think we all best learn when we learn from each other. as was mentioned earlier. So I'm very much looking forward to learning from all of you. The presentation I'll be presenting is from the Alzheimer's Association. I'm one of the board members, and many of us volunteers go out into the community to share the wonderful information and organization from the association. So please feel free to jump in. I think many of you are well versed in wandering, and so this will be maybe a review. And so I look forward to hearing from all of you too. Ivy from the association may join, and if she does, then she can also jump in. Also, she's the director of programs. So let me get the PowerPoint going. And I figured out how to make it in presentation mode so we can get started. Okay, so I might not be able to see what's in your chat. So if you're going to add in chat, please add in chat. And if not, just please open your mic. You don't have to wait for me to be done. But today we'll talk a little bit about wandering and dementia, something we're all familiar with. And I guess everybody here is working in care homes from what I'm understanding. Lynette, you're the only one I can see. So I'm looking at your...
Also foster homes.
Oh, okay. All right. So all of us are have dealt with wandering. All right. So let's get this presentation started. Okay. Oh. So I like PowerPoint. There we go. Oh. Sorry, everybody. There we go. Tech. It's always wonderful. Okay, so what is wandering? Wandering is very much something that I think many of us, like I was saying, are used to and have seen, right? It's really the person getting lost or becoming confused. And I really want to emphasize that confused. It's not always about getting lost, right? So a lot of times the person with Alzheimer's, dementia, or other related Alzheimer's or other related dementias, right? That state of confusion grows and grows and grows as the disease progresses and progresses. And so all of us have been in situations where we're confused. We've all had times where we're driving or we're in a situation where we're not exactly sure what's going on. And so it's just really important to always look through their perspective and what they're going through, and just to understand that that confusion just continues to grow and grow and get larger. And I wish I had a picture to show of that. But so besides them getting lost or getting confused, it's really, right, anxiety can be anxiety provoking for the one living with the disease. About 6 of 10 people with Alzheimer's wander at least once. It's a huge percentage. And although it's stressful for us, the ones dealing with it right in the home, many times it's really extremely stressful for the person living with the disease. And like many of you, we all do the best that we can. The part I think that gets very concerning is that when wandering becomes dangerous for others, it can be very dangerous, right? If they leave the facility or the home or the foster care, or they leave the hospital, or they wander into the community. We've all seen on the news many of those in our community who have wandered, some who have had great outcomes and some who have not. And I've had my own experience. They mentioned I'm a caregiver to my father. I also used to be the director of clinical services and the interim ED at another long-term care community here in the islands and an adult daycare center. So I definitely remember this. But the scariest part for me was dealing with it as a daughter when my father went missing. And my father was found, so I was very lucky. But for others, it's not that way. And then when we're the ones in charge of a facility, it's very scary too if one of our residents do not return or wander off. And so kind of what are the things that we can do about that? So who's at risk to wander? Like many of us know, everyone with dementia is at risk to wander. They don't really recognize familiar places, and they don't recognize new places. And so it can be very disconcerting, even if they're in their own home and are trying to get home. And I think many of us, I would assume, have dealt with that, where we have a resident who asks to return home, who wants to go home. And so things that have been tried in different communities, right, have been to try to make their bedroom or the place that they're now living in mimic their home. So a lot of times I would ask my families, when we had a new resident coming in, please bring things that are familiar to them from their home or from their bedroom, whether it was the furniture, the blankets, the paintings, whatever things that made them feel at home, so that we could mimic it as close as we could in our community. Bring the games, bring the foods they liked, everything that would really help them to try and feel at home. And we've had many who wanted to go home, and so other things that we did, because once, even if the bedroom mimics, right, their home, and then they walk out of their bedroom, then they're looking at the community and it's not familiar, is really trying to understand them and their story. Are they talking about their most recent home? Are they talking about where they were growing up, where they were married at? And other things with distraction. Of course, many of us use distraction, trying to get them into activities. But sometimes we would take them on rides in the community. We would, take them on a physical ride, so that it would seem as if we had left that place and we were going home. And then we would come back to the community and, announce we've returned home. And sometimes that would work and sometimes that didn't. And I'm sure many of you out there have tried many things that have worked, or, may have led to what would work. And as mentioned earlier, many people who are not found, that first 24 hours is critical. And some who are not found within those 24 hours don't have the best outcomes that others have. Okay, what are some of the how do we know people are going to wander? So this is not an exhaustive list, right? The words they say: I need to go to work, I want to go home, I want to go. Sometimes it wasn't home and work. Sometimes people were asking to go to church, or if they had been part of a community organization, or if they had done something repetitively on a certain day of the week, they would be asking to go to those things and return. And those are things that, when we were making their activity plans and trying to coordinate everybody's activities for the week, group and personal, we would really try to understand that, so that we could mimic if they did something on a certain day at a certain place. Was it exercise? Was it getting together with their friends? Was it playing cards? Was it going to church? And if we couldn't physically get them to where they used to go, then we would do our best to mimic it within the community. And even at home, when I had my father, we would try to, routines are really good, right, for people with Alzheimer's and other related dementia. So I would try to mimic his routine at home, like when he got up, what he did when he left for work. So taking him somewhere during that time, bringing him back. And so kind of really trying to focus in on who they were and understanding what they did in their lifestyle. Sometimes they're restless and they pace around, right? They're returning from their walk, usually late, or returning from driving or from where they were going at a later than expected time. They got confused. They were not sure exactly how to get home. They can't get to familiar places within the community, where they're living, in the neighborhood. And so these are all familiar things that we're used to hearing and seeing. And so then how do we mitigate that so that we can help them to still feel like they're having independence, that we're right, validating their emotional, what they're trying to tell us emotionally, and then help them to find some calmness. In the crowded areas, I think sometimes we forget, like the holidays, right? We have everybody come, we're going to celebrate, we have food, and we have Christmas and Thanksgiving, and so we have a lot of people and a lot of noise and a lot of visual things going on, right? There's colors, there's songs, there's voices, there's food, there's smells, and there's so much that sometimes, even though for us it's very much time to celebrate, it can be a little overwhelming, which can overstimulate, and overstimulation can also lead to wandering. So what are things that we can do? We really never want to argue, if we can, with somebody with dementia in all areas. So even when they're wandering, right, not confronting, not yelling. If safety is an issue, then sometimes this will happen. But we really want to take a step back and really assess the situation and try to see what is happening, what are they doing, what are they trying to communicate with us, their needs, their wants. Is it too much for them? Are they trying to get away so that they can take some time to recenter themselves? Is something else happening? And I think some that I can share is, we did have a resident one time, and he worked night shift, the resident. And so going to bed was a very difficult time, or just at night in general. And so really looking at his life and understanding why he was trying to get out of bed and walk around the facility was really tied to the job that we had. And so we mimicked that situation of what he would do when he was a supervisor at night. And when we would mimic that situation, he would get up and he would do what he felt he was doing at his job, and then he would go to bed. And we also had another person who was used to running meetings and being an administrator, and that's what was driving the wandering as we kind of figured out what was going on, what are the triggers, the time of day, what is happening, what was like. And so he would join our meetings that we would have with the team or the staff, and he would join the meetings and he felt like he was part of it and he would contribute, and and he felt that he was being part of that and that he was leading it. And then after that he would go to his room and he would be calm. And so those were just some of the ways that we were able to help with some of the wandering. So we can do things like giving distraction, right? Using food. Do you want coffee? Do you want some interaction? Maybe they're bored. Maybe they just need somebody to talk to. Maybe they need an activity to do. Maybe there's something a place they want to go. And so all of this just really gets taken into account as we look at every individual and try to really hone in on what specific is making them wander. It definitely can be things like like a UTI or other things that are happening, but we really want to try to figure out what is at the root of that wandering. So this just being a detective, all caregivers are a detective, whether you're a professional caregiver or a family caregiver. Being a detective is at the core of being a caregiver, right? As the disease progresses and they cannot relate to us or express to us their needs and their verbal wants, it really is up to us to then begin to figure out what they are trying to tell us. And many times, it reminds us of when we are working with others, or I've had a lot of staff say it reminds them of when, they've had children. Not that the person is a child or that we're going to treat them like a child, but that when children are unable to fully talk and express their needs, right, we do a lot of detective work then. And so it's kind of doing that again, trying to understand what it is that they're trying to communicate with us and what can we do to help in that situation. And so here's, kind of a list of some of the things as to why they might be wandering. Lighting is really important when they can't see. It can make it very difficult for them to feel safe in environment. Even at night, in a lot of communities, there's shadows, right? The wind hits. And so they may see shadows going around their bedroom. And a lot of times when we close the doors, we feel that they are not always hearing us and what we're all saying in the hallways. And many times if we stay in the room, then you kind of get a sense of what they're able to hear as we're walking around outside the rooms, right? Night shift is happening or things need to happen as people are talking out in the hallways, as the shower turns on the next door, or the bathroom or the toilet gets flushed in the next door. It's all can be very loud. Lighting also helps them to see where they're going, right? A lot of times when they're trying to go to the bathroom, they may go to a closet. And so signage, lighting can help. Also making sure that there's drastic color differences, right, between the wall and the floors, even with the toilet seat, just making the water blue or putting a different toilet seat cover on the top can really help them to catch their vision and help them direct to where they're going or what they need to do. And so trying to going to their home, is pretty common and one that I hear a lot. Even when they're in the office with me, sometimes they're asking, to go home. And so we definitely do our best. But what helped a lot for us was that we would take them on a ride. We say, yes, we're going home, and we would, take them driving for a block or two and then return home or do an activity with them. Can also matter on where they think they are, what year that they think it is, what is familiar to them, what was happening at that time. And so we all do our best to just really try to help them deal with this situation, this overwhelming situation, this confusion that is not going to go away, and to just help them to feel calm and safe. And so we want to change the why and the how. So we never want to leave someone unsupervised in a new environment. It can definitely be scary for them, confusing, overwhelming, and can lead them to try and find their safety blanket or to feel safe again. And so they may leave. We can provide structured activities, a distraction. And the word we were talking in this is, looking at where they are in their journey and hoping or making sure that whatever we're choosing activity, that it meets their needs. It makes them feel that they're having a purpose. It kind of fits in maybe with who they were. Did they like gardening? Did they like reading? And if they did, where are they at now in this journey? How much assistance do they need for us? Is this something they can do on their own? Do they just need verbal directions? Do they actually need you to sit down next to them and move their hand? And so a lot of this goes into what stage are they in, the structure, the purpose of it. Do they understand the order? And really fitting the activity that we are trying to do with them to the stage that they're in. And of course, regular physical activities, right? Walking, running, tennis, golf. We used to play so many sports, and we'd have so much fun, as everybody would relate what they liked to do. And not everybody likes to do physical activities, and that's okay too. We can do things like painting, putting jewelry together, sometimes, and many other things that they enjoy and they like to do. Safety plans are always a great addition, but for most of us, if we're working in a community, we do have safety plans as part of their care plan or part of what needs to be completed for their files. But we do ask that, of course, whether they're in a community or if it's a family caregiver, that they really keep all this information that can be accessed very quickly and very fast. So photo descriptions, and if someone goes wandering, right, an up-to-date photo is really, really important. Sometimes, photos stay in the files or in homes, and it doesn't get changed by the time something like this may happen. The person looks drastically different. And so please try to update the photos and any information that is happening, especially details about their car, their location, if there's any devices. You can have a Word document, PDF document. So the Kapuna like to keep things on paper, and that's totally fine. But if you can, we really suggest, to have it on paper, but to also have it somewhere on a computer or in the cloud, if possible. And you also can work with your healthcare providers to keep some of that information together. You can also work with organizations like the Alzheimer's Association, the National Task Group, and RCI, Roslyn Card Institute, and the Savvy Caregiver, or the Caregiver Foundation here in Hawaii, and many organizations have all these templates. You don't have to do it. They have all these templates ready to go, and they can definitely send it to you to make it just a little bit easier. Some of the adaptions that a lot of people, and I'm sure that many of you know more, have more to add to this list, so please don't hesitate to add on. But there are things like hidden locks, right? The night lights, so that people can recognize their surroundings. And a lot of times you can make the lights so that it's a direct path to the bathroom, or maybe if they go to the living room, that's the routine. They always got up at 2 a.m. and went to the living room to have water. Do we want to put water next to their bed or light it up, as long as it's safe for them to walk towards the kitchen? Some have used camouflage doors, curtains, or printed screens, or you can buy the wallpaper that makes the door look like it's a bookcase, or you can put things over the lock so that they're really unable to open it. You can label things in the house if that's still helpful to them, if they're still able to read and understand signage. You can put fencing around the yard, and it really depends. Some of them have a safety that, it might be a person. I've seen that happen quite a few times. It could be a physical object. It could be something that they like to do, and sometimes it's animals too, that they prefer, to have with them. And sometimes we've used those joy pets, the animals that look like a real dog and cat, and they purr and and they bark, and you can pet them. Some others have used, babies to help with this. And so it really just kind of depends on what their needs are, and kind of what will help them to get through this. technology is wonderful, right? There's AI everything now, and AI to help us with this and that. And of course, it's already in the health or the medical field, and it's being used every day and growing more and more, right, across all of our industries and in the community. And so many people have used AirTags, which seems to work out well. Medical ID bracelets, and the Alzheimer's Association does have ID bracelets as well as many other places. Alexa has been used. I have seen Alexa used a lot. Home video cameras, the baby monitors, the recording devices. I think, a lot of times we just want to keep them safe. So these are very good to use in the homes, of course, in community, depending on what the regulations are, where these can be placed in a community setting or in a facility. It really would determine on where these can go. But these are all great ways. There's a lot of new technology coming out that can assess whether somebody's going to fall. And if they do fall, it can alert the nurses or the nursing station. It can send out an alert to first responders, and a lot of activity to track, when they're using the bathroom, and all of these new things that can really help us to understand the routine and when it would be best for us to fit or to create their activity schedule. I love music therapy. I used to do that with my father a lot too, and he's hard of hearing, so I would place the phone very close to him and near him, and he would hear his music and he would just light up and smile and dance and move. And in the beginning he would still try to sing, but after, when he was no longer verbal, he would just kind of move his body. And still to this day we use music with him. He's bedbound now, he's in the end stage and he's on hospice, but he still can see just a little bit light coming to his face when the music comes on, his favorite music, and and his foot begins to move, or his finger. And so it's like one of the best times of my day. Okay, driving is one of those that always comes up, right? What do we do about driving? They want to drive, and in some places they are able to still drive, whether they're at home or they're living in a community setting. And so it really just depends. There's no specific way to deal with this. It varies from person to person, right? Everybody is different. And so these are some of the things that that we're worried about. Of course, safety is number one, and we all know that as the disease progresses, right, it does affect their vision. And so what is impaired? Is it their spatial ability? Is it their ability to plan ahead, to problem solve? Do they get distracted easy? And these are all things that can affect them when they're driving. And of course, for us, we get very, very, very worried. So here's some of the strategies that the association has, put together that you can ride along with a person. That's really good to assess where they are and to see how they're doing. And I would say to do this at different times of the day, not just at one time of the day, because people are different. Morning, evening, when the sun is out, when the sun is glaring in. Of course, the later end of the day into the evening, it's harder to see things visually. And if your facility allows people to bring their cars with them and they're able to drive, this is something to talk with them about and their family. So you can discuss your concerns with them. Are we talking about a driving retirement? But, taking away someone's ability to drive is really taking away their independence. So if we're going to talk about driving retirement, then have things ready to offer them that can supplement the retirement, right? Whether if they still have the capability, the capacity to take handy van or to call for ride shares, is that something that they're still able to do? Or are you able to provide transportation so that they feel that they are still able to go somewhere, I don't know, every Friday at 2:00? Or is there other things that we can do? Can their family come and pick them up? We really want to try and supplement the independence feeling and not just remove it entirely. Sometimes having the doctor write a script or taking them to see the provider, whether it's the NP, MD, PA, whoever is in charge of their care, and letting them talk with them, or write down that they feel that they shouldn't be driving. That has worked. Taking them to the DMV, also disabling the car, disabling the battery, taking the air out of the tires. But I know that some families have done this, and the person has called, right, for a car to be towed and taken to an auto shop, or have called to have it fixed. So just understanding where the person is in their journey, and if you're taking on some of these strategies, what may follow after. And so we very much are familiar with these faces. They've been on the news. We've seen them quite a lot, which brings us, of course, to the silver alert. So I think many of you were there in July, or some of you were there in July, right when the governor signed those 16 bills into law. And some of them had to do with long-term care, with Kupuna, with Keiki, and many other initiatives. And so, of course, the silver alert was finally passed. It wasn't the first time it was introduced, but we were really excited to join many other states who had their silver alert passed in legislation. And so it's basically going to work similarly to an amber alert. So if somebody goes missing, right, then we'll be able to send out a silver alert versus an amber alert. And when my father wandered, and many others that we have seen before this, right, there was no silver alert, not here in the state, not in the community, nor at the facility that he was at. And so, this, of course, was very special to me too, that the state of Hawaii finally passed the silver alert. So we were really excited. And so that's a picture of all of us there. Not everyone who was involved, but many of us and many of the people that were involved in getting this passed. Okay, the next part is just a little bit about the association chapter and kind of what they do, what they offer, what's available. And they do have a 24/7 hotline, which many people think are only for family caregivers, but it's not. It's for everybody. It's for professional and family caregivers. So 24/7, if you have a question, if there's something that you want to know, please call a helpline. They also do have training and education specifically for communities. There's also many other programs, right, that offer those services too, but the association does have and offer that. And so, of course, if you guys are here, November is the next walk. So please, if you'd love to join us personally, or you want to create a team with friends, family, colleagues, co-workers, with the residents, we would join our community. And during COVID, we walked around, of course, our facility, but we'd put a team together. And so it was nice at the facility and at the health center where I worked at. And so it was always a lot of fun. And the longest day, please join us if you'd like to. You can get in touch with me or Ivy or the association to learn more. And this is the local office number, their email, and some of the staff that has now joined the team. So thank you guys so much. And I see that there's things in the chat, so I'm going to take a look at that. But please, if you would like to open your mic and share anything or ask any questions, that'd be great.
Naomi shared that her friend's mom took a taxi and bought a new car. Does anybody have any experiences that they want to share, or even a successful approach that you've done?
At our doors before they exit, the entrance exit doors. So what we do is we painted the floor black so that they think, yeah. So that's how all of our escapees don't run away.
I love that. And if you guys can't paint, you can put a dark colored mat or sheet down, and that'll also work in the same way that the paint does, to help deter them from trying to go through the doors. Yep, I love that one. Thank you for sharing that. Well, I know. It's great to see you, Tani. What about anybody else? I know wandering has happened in other facilities. Anybody else have anything they've tried? And even share things if they haven't worked out successfully. Maybe everybody on the call can help out. And I know this might not be part, but wandering is big for the facilities, and of course, we still have some locked facilities, and there's a big movement to kind of move away from that, and other types of facilities that are coming, that are mimicking more of home models, which I thought is awesome, because Hawaii kind of already has that and does that, and some of it pertains to wandering to help deter from wandering because it is built in such a home-like environment. And a lot of these are starting to move across. Well, they've been in the States for over 20 years and have begun to move internationally. And so it's been interesting to see what's happening, outside of Hawaii also, and what's happening internationally in regards to these spaces.
I have a
Yeah.
question.
Oh, go ahead, Leilani.
Okay. Is it illegal to put an air tag on a resident, even if you declare it to like the family and the resident?
I can't see who was talking. Who was
Oh,
that?
I'm not on video.
Oh,
Is it
is
illegal to put an air tag on a resident, or yeah, is
do
it
you have?
illegal?
Are you in a arch or a foster
Yeah,
home?
an arch.
Oh, so OLCA is your governing body. Yeah. So then I would definitely say the OLCA regs that are out address some of those, right? Like you can't put a camera in their bedroom. So if there's still questions you have, because I don't want to speak for Justin and Debbie unless somebody else has had experience with this and has got an answer, then I would definitely say Justin is wonderful. He loves when people reach out and ask him questions and check with them, or even whoever the nurse that is assigned to you to do your yearly survey. Uh, I would say if you have questions about that, to reach out to them, because getting an answer straight from OLCA would be the best for you so that you can, be in compliance. And of course, if it'll involve family, then you can involve family also.
I do have a funny experience. It probably happened like maybe a couple years ago. I took two residents with me just because I went to Kailua. Just wanted to take them for a drive. I went to bring my dog to the vet in Kailua. So the one resident, he's very hard of hearing, and the other resident, he's got a dementia. So I left them both in the car with the alarm on, just thinking it's going to be a quick drop off for the dog. And when I got back, the one who had dementia, I couldn't find him. And it took me like 15 minutes to find him. And I went to each establishment within close proximity, and the car was just like 10 feet from the curb. Anyway, it was scary and funny at the same time, but never leave them alone. That's the lesson learned.
Thank you for sharing that, Leilani. And I'm so happy that everything worked out in the end. And you're right. It could have gone another way, but thank you for sharing. And what happens sometimes, what things that we're going through in the real world. And yes, I would encourage people with dementia, Alzheimer's, other related dementias. We can't always know what is going to happen. So I think how you ended it, never leave them alone, is what we're going to take from that.
Yes.
And thank you for sharing. Anybody else have something they want to share or something they've been through?
It gets back to the wandering. So they can wander anywhere outside, of course, but the problem is that they always want to walk up the stairs, which gives me a heart attack. So what do you do for that?
Oh yeah, we had stairs in our place too. What I do want to say is that although all of us are sharing right great ideas, as we all say, you met one person with Alzheimer's or dementia, you met one person. So one strategy that works for one may not work for everyone. And so right, we're going to play detective, and it might work for one person in your facility or community and might not work for the other person. So definitely might have different things. We at some things that we did while we were dealing with wandering in different situations was we tried to block it off or hide it so that it would be out of sight. Because you're right, the stairs was like, I don't know, but it pulled. It was like a magnet. So we would try to not have it be seen if we could. Other things we did was we would deter the path the walking path away from it. So resetting up the space where the stairs was at so that they wouldn't be walking past it or going near it. We would play games and have dance parties or dance with them. If we knew we were getting close to the stairs, like sway side to side or distract them, talk to them, go another way. We'd dancing with them was a lot of fun because they would be paying attention to us and then dance and then past the stairs. I think at night shift it was more when the staffing is down, that we had to come up with a little bit more creative ways to block out the stairs. So we used lighting, we used the dark cloths, the sheets, and a lot of those things to kind of move away and light up other areas, and as long as it was safe and we can make sure they went that way, so that would be the focus. That's what they saw in their visual, and they would go that way. But if anybody else has any ideas, please share.
Hey, Dr. Balas, I thought I saw Ivy on from Alzheimer's Association. Ivy, are you able to explain about the Safe Return program and how to enroll?
Yeah, hi everyone. Sorry, I'm off camera at the moment, but I am here. Thank you for the opportunity to share, and mahalo Dr. Balaz, for your mana'o. But so our involvement with the 24/7 wandering support is quite limited. However, we often will guide folks to the Medic Alert and Safe Return website. They have a full service program. They have different wearables and accessories that folks can look at. So it's usually purchasing the jewelry or wearable, and then there is kind of a monthly ongoing fee to pay for the service. Again, we used to have a partnership, and we're very involved in that. That's not the case anymore. But we will often just refer folks to the website. I know that Medical Alert, they have a scholarship program, so they really try to work with families if finances aren't an issue. So I hope that's helpful. But if you go to the website, there's kind of a nice catalog of different options to choose from. Hope that helps.
Thanks, Ivy. Do we have a link to that?
Let me find it and I'll throw it in the chat.
Awesome. Thank you, Ivy.
Thank you.
Does anybody else have questions or stories they wanted to share? Thank you, Dr. Balas, for that wonderful presentation.
My mic was off. Thank you. Say thank you to all of you, and for allowing me to be here and the opportunity to share this space with all of you. So please have a great day.
I wanted to share some more about wandering. Thank you for an excellent presentation. We got to think about all of these things, from environment to lighting to so many things we can do to prevent somebody from wandering. My mother wandered when she came to Hawaii to visit me from India. She was here for 6 months in 2022. And, I was off to a class and my mom told me, "Oh, darling, my back is hurting, you go." And my dad and I have left the house. And later I get a text from a neighbor who says, "Rita Bell, your mother is lying in my driveway." I was like, "What?" And, my neighbor thought maybe we had a fight at home, because at that time, nobody knew my mother had dementia. So, the neighbor thought maybe there was an internal family feud and my mother walked out. But actually, my mother left the house, thinking we all went to church. In her mind, she thought we had gone to church and we left her and we didn't take her with us. So she walked out of the house with her Bible in her hand. She had changed her pants to a more formal Sunday wear. And I have no idea why she took a towel. I don't know, like the old days where you covered your head in church. I have no idea. But she has gone off, and the only thing I think about is there were some angels watching my mother, because she could have gone to any home. She could have walked into anybody's house, but she went to the neighbor who knew me, who texted me and said, "Your mother is lying in my driveway." So I want you to know that this happens. This is a real possibility. It really happens. And considering enrolling your client in the safe return is of great benefit, because then the police, the first responders, they don't have to wait 24 hours to declare somebody missing. See, that's the beauty of that program. They can search for the person right away, immediately. So this is a very critical point, that you don't have this 24-hour waiting period, and the photograph of your patient will be with the police, with the first responders, so they can search immediately. I even had a patient of mine who lived, opposite Kwakini Hospital. She was an old Japanese lady living alone, and her son was a board member at Fukuoka Valley. So we used to visit that family regularly, do home visits. And one day it was so sad, and the son was very, very devoted Japanese son, very devoted, visit mother every single day. And then one day when he visited, he said, "Can you believe, Dr. Fernandez? My mother was out the whole night. She had fallen in the garden, and the whole evening, the whole night, poor thing, she slept outside till her son discovered her the next day when he visited mom." And this is so important to have, especially for people living alone, the personal emergency response system, PERS. The PERS is really important, because at least they have a button. They can press a button and call for help. So you don't have to have somebody, sleeping in the garden because they're stuck and there's no one to pick them up. So there are some real sad stories, and we got to think about this, how we can keep our clients safe. Especially in 2024, we have so much technology. See, that's a good thing. That's a good thing today. We have so much assistance on our phone, on our smartphones, and things that we can use. So I really want you to look into this. Ivy, thank you for putting the link. We can really use the help from the Alzheimer's Association. It's an excellent program.
Thank you, Dr. Rita Bell. So shall we, you mentioned about PERS, the personal emergency. There's also the fall detector type. So in the event that the person is not able to call because of dementia or confusion, if they fall, there's a way for that to be detected, and it will call the operator somewhere, and will send the dispatch or contact the family. All right, if there's no more question or sharing, shall we cover the evaluation part? Okay, so these are questions that are in the evaluation. There are 3 of them. How many of your residents have been screened for dementia or memory problems in the last year? Second question is, how many of your residents have been screened for depression in the last year? And the last one is, how many of your residents had an emergency room visit or were hospitalized because of agitation or delirium in the last year? Again, for those that are seeking CME, if you would like a certificate, please complete the evaluation, and that certificate will be sent to you at the end of the year. For the others, make sure that we have your correct email addresses and your name, and complete one evaluation, not as a group, but per individual, per person. Thank you so much, as always, for all the work that you do, for taking good care of our members, our folks in the community. We appreciate you so much. And thank you for being here. And I'm so sorry that my video isn't working today.
Thank you, Dr. Balaz. Thank you, Dr. Rita Bell. Everybody, thank you so much for attending today.
And I wanted to add, if you see that QR code on the screen, just point your camera, your phone, to that QR code, and it will take you to that evaluation, and you'll be able to complete it using your phone. Thank you so much.